Well, I wanted to elaborate a little bit more about the acupuncture, especially for women who are going through hot flashes. And as soon as you said that, Dr. Maizes, I wanted to be like flailing my hands in the air, going, "That's me, that's me!" And and what I've learned, and Dr. Harness and I have talked about a couple times, is, you know, I take care of my body so much more now after the breast cancer than prior, which I'd like to talk about that too. But here we are, and I'm going through all the fun menopause stuff and the hot flashes. What do you suggest regarding the acupuncture if somebody would entertain doing something like that?
Well, I do think that acupuncture can be incredibly helpful. I have recommended it to many patients. Many patients have used acupuncture successfully. It doesn't mean it'll work for everyone. I suggest that people give it a try. A try doesn't mean one session. It may mean 4 to 8 sessions. If they haven't perceived benefit by the time they've done 8 sessions, the likelihood is not great that it is indeed going to help. But there are other things. For example, I don't know if you ever used the diaphragmatic breathing. There's been a large number of studies that show that if you can activate the parasympathetic nervous system, and you can do that through slow, deep, quiet breaths, that can sometimes head off a hot flash, and it also can make them less severe.
Isn't it interesting that you said that? I'm sorry, Dr. Harness. Go ahead. Go ahead, Dr.
No,
Harness.
I was going to say, Victoria, you and I as physicians, we throw out big fancy words. Parasympathetic. Most people don't know about the
Yes,
sympathetic and
thank you for
parasympathetic.
reminding me of that. So there's 2 parts to our nervous system. There's the sympathetic, which we sometimes hear spoken of as the fight or flight. The stereotypical saber-toothed tiger, or maybe it's your boss who's just given you a bad review, and we have our heart racing and we're ready to run. But the quieting side is often less well known about. That's called the parasympathetic nervous system. We sometimes refer to it as rest and digest, and it's responsible for the quieting functions. And we still don't fully understand the physiology of hot flashes, but it turns out that some of the physiology is actually quite similar to the sympathetic nervous system actions in terms of increasing heart rate, increasing blood pressure. And the quieting side, the parasympathetic nervous system, is what's activated by breath work, by things like Tai Chi, by meditation. And so those things can help. Now, you're not going to meditate really fast when you're having a hot flash, but you can take a slow, quiet breath, and there is evidence to support its value.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.